We need to recognize that our people are our economy. We can figure out how businesses can run and how they can open and function safely. The economy can recover, but people cannot recover from dying of COVID-19.
That's the voice of Michigan Lieutenant Governor Garlin Gilchrist II. And he's our guest for an in-depth conversation today on this edition of Your Daily Detroit. This is episode 41 of the podcast for April 11th, 2020. I'm Jer Stays, and joining me from his basement studio will be my co-host, Sven Gustafson. We talk about a wide variety of topics with the Lieutenant Governor. There's a new task force to examine the higher rate of African Americans dying due to COVID-19. We talk about unemployment benefits, where Michigan is at in flattening the curve, a possible policy to help bars and restaurants, and much more. So let's get started. Welcome back to Daily Detroit, sir.
Thank you. It's good to be back with you guys.
Absolutely. So there are a bunch of things I want to talk to you real quick about because obviously there's a lot happening. The first thing I want to start with is this task force that Governor Gretchen Whitmer has tapped you for around the coronavirus. There are some really impacted communities right now. Can you talk about what's going on with this and kind of what the goal is?
Sure. So the task force is about the racial disparities that have become evident as part of the COVID-19 pandemic. Black people make up 14% of the population of the state of Michigan. But to date, 40% of the people who have died have been Black. There's clearly a disparity about how legal this is to Black people in Michigan. And that's present nowhere more than in the city of Detroit. So this task force is looking into those racial disparities. What are the causing factors and what are the interventions that we can undertake right now and over the long term to not only close the gap in terms of the disparities in COVID-19, but also address the longer term structural things that contribute to these health disparities, structural racism, persistent poverty, inconsistent connection with the healthcare system, all these factors and other social determinants of health that we need to address in order to make sure that people can be healthy all across our state and all across our city.
Lieutenant Governor, you're chairing the task force, of course. Who else is on the actual panel? And have you guys already met? Did I see you've already had your first meeting?
So we're pulling it together as we speak. We're going to have our first meeting tomorrow, and it's going to be pulling from a number of areas. We're going to have, first and foremost, public health leaders, medical leaders. We're going to have community members. We will have lawmakers. We'll have people from the education community. We want this to be a representative sample of those who have ideas for solutions to this issue. The committee is going to meet very often, multiple times a week, because we have a lot of work to do and we need to deliver interventions quickly because every day matters in the context of this pandemic. And I think that Michigan really is a leader here. Not many states have established task forces like this to particularly look into this racial disparity. But the truth is it's present in other parts of the country as well. So we hope that we can develop solutions that will be exportable and that we can be a national model.
And do you have a projected timeline for when you want to have, your results compiled and work wrapped up and everything?
We need to get cracking right now. We expect to show some goods in the first week of our work because, again, we don't have a lot of time to waste. And so while we are going to be diving into the data to have an understanding of what we know today, frankly, we still don't have enough data because we don't have enough testing capacity here in the state of Michigan yet. More people need to be tested. More people without symptoms need to be tested. And we've shown some promise here in the city of Detroit with the drive-through testing and the 15-minute preliminary test results that are available for the Abbott Labs testing kits, but we need so much more in order to have an epidemiologically rigorous understanding of community spread.
And that testing, I assume, will help drive some of your interventions. Is there any idea of what kind of interventions we're talking about, or is that still to come?
Increased testing itself is an intervention, to be clear, and how we can target that testing capacity as we work to increase it with a pipeline from the federal government as well as procuring tests from other sources. But there may be other interventions as well. Interventions to deal with some of those disparities in the near term, interventions to perhaps have different protocols to make sure that we have safer public transportation, safer in the context of the coronavirus and how we're taking care of not only the professionals who are driving those buses, but also the people who are reliant to ride them to get to the grocery store or get to the pharmacy or get to their critical infrastructure job as a sanitation worker or as someone who is working at a utility company to keep the lights on and the gas on and the electricity on and the internet on so many people can stay home and stay safe.
Lieutenant Governor, what's your assessment about sort of where we are as a state in terms of flattening the curve? What kinds of things do you think Michigan is doing well, and what are some things maybe that we're not doing so well at?
Well, testing, I think, is one that we need to increase, just like a lot of other states in the country need to. We needed a national strategy to acquiring that infrastructure, and we still don't yet have it. So we're working to build one on our own. We also have the opportunity to continue to be even more transparent than we have been and releasing more data as we collect it in a rigorous way. We were one of the first states to report cases and deaths broken out by race. And now we have, as of a couple of days ago, we found an accurate and we think rigorous way to report recovery numbers. And so we started to report that as well. So we're going to continue to improve on that front. But I think it's been clear that our administration has taken bold action. We issued a stay home, stay safe order earlier than most states, and one that was frankly less porous than other states, because all of the evidence from other parts of the country and other parts of the world show that you need to take aggressive action and aggressive action early in order to get out ahead of the community spread of this virus. And that's what we've tried to do. And we're hoping that through our further extension and amending of the stay home, stay safe order through the end of the month, we will be in a place that is safe and where people can start to think about what our new normal is going to be soon.
Well, with that aggressive action has come some criticism. What do you make of that criticism?
I think this is unprecedented. So people, don't know how to respond to it. This is upending so many elements of our lives because we've never faced anything like this. Nobody alive has dealt with this or certainly led or governed or run a business in the midst of it. So it's difficult. So that doesn't surprise me that people have opinions on things they want to see different. We understand that. But our choices are grounded in the fact that we have a primary responsibility to protect and promote the public health and the public safety of the people of the state of Michigan. And all the questions, especially about how are we going to restart the economy that are coming from the White House, from the Michigan legislature, and everywhere in between, we need to recognize that our people are our economy. We can figure out how businesses can run and how they can open and function safely. The economy can recover, but people cannot recover from dying of COVID-19. And so we need to be real about that. The choices we make need to be about protecting people from getting infected or enabling people to recover from the infection. And if and when we're able to do that, then people will have the confidence to be able to go out safely and to re-engage in economic activity in a way that will make sense for us and to help us restart our economy.
We know that this is obviously causing massive economic disruption and probably a lot of damage. I mean, Michigan's not unique in that way, but what can state government do to sort of aid the economic recovery? And what are you doing right now to kind of lay the groundwork for that?
So we're trying to do things in real time. We've expanded access to key parts of the safety net to try to deal with this, expanding access to healthcare so that people will be able to have any testing and treatment covered during this COVID-19 pandemic. We've expanded access to unemployment insurance, and we've seen an unprecedented amount of people, a record amount of people apply for unemployment insurance in Michigan and frankly around the country. We also have made our unemployment insurance, beyond being available to more people, they're available to people who work as contractors or 1099 workers or gig economy workers for the first time ever, thanks to a deal that we struck with the U.S. Department of Labor. We have made our unemployment insurance benefits more generous and by extending them for 6 weeks from 20 to 26 weeks. And then working in partnership with the federal government through the CARES Act, there are now a total of 39 weeks of unemployment insurance available to people and an additional $600 every week available to people to get through this unprecedented time, such that it would lead to unemployment insurance income on an annualized basis that is roughly the same as the median income of the state of Michigan, which is higher than the median income for the city of Detroit. We're trying to make sure people have what they need to be able to stay home and stay safe and not feel like they have to go outside because they need to get the money to get their necessities, to get their groceries, to get their prescription drugs and gas for their car and these sorts of things. So we're trying to do things now with an eye toward the future as well.
You have a technology background. We talked about it the last time you came on our podcast 3 years ago, and it was a great episode. Background with Microsoft and MoveOn, the city of Detroit and everything. Is there going to be a technology and data component, do you think, to our recovery efforts here in the state of Michigan?
I think so. I think there's going to be a lot of questions asked, and it'll be forcing us to imagine how a lot of businesses function. So many people are working from home in a way that they never have had to before. I think there are going to be a lot of new business models developed as a result of this. I think a lot of businesses that are existing are going to realize that maybe their people can work remotely and it'll change their cost structures and realize that they don't need the physical assets that they thought that they did. Maybe this will help us drive an investment in our internet infrastructure, something that I've been leading on in our administration thus far. And I want to see every community and every household in the state connected to broadband internet. That certainly is really important right now as we have kids home from school because we ended face-to-face education in the name of public safety. But kids still need to be able to learn something, and we want to facilitate learning at a distance. So I'm working to put internet-enabled devices in the hands of the 480,000 children across the state of Michigan who don't have access to a device at home, or the 48,000 children who don't have access to the internet in their homes. And that perhaps will revolutionize the way we deliver educational content. So that's exciting because it can lead to innovations. It can lead to new models and new paradigms that we can keep with us as we establish a new normal.
Obviously, a lot of the recovery is going to hinge on assistance from the federal government. What sorts of things are you and Governor Whitmer lobbying the federal government for?
I mean, the Michigan delegation has really been great during this time. All of our members of Congress on both sides of the aisle and our two senators have really been fighting hard for the people of Michigan to make sure that we can draw down as many resources as possible. Let me give you a couple of examples. I alluded to the unemployment insurance benefits before. The extension of our benefits to 26 weeks has enabled us to pull down an additional 13 weeks of unemployment insurance from the federal government. The additional $600 is going to make unemployment insurance go a lot farther for a lot of people here in the state of Michigan on a week-to-week basis. I also launched something a week ago, Friday, called the Michigan Paycheck Protection Program. And that program is for the smallest businesses in our communities, the sole proprietorships, the small LLCs, the barbershops, that they can get an SBA-backed loan from their banking institution if they commit to keeping their people on their payroll at their same salary. Or if they do have to let someone go, they immediately hire them back at their same salary. This payroll protection loan will be able to cover payroll, it'll be able to cover rent and some other utilities and expenses. So these are the things that I'm working on in partnership with our federal delegation to make sure we have the tools that people will need to be able to be mindful of these emergency orders in the name of their own public health.
You were talking about the need for more testing. The governor, of course, I think it was last week, went on TV and said that vendors are not sending medical equipment to Michigan because they're being told not to. Has that situation improved? I mean, where are we at in terms of getting, badly needed medical equipment to fight coronavirus?
Things are getting better every day, and we're slowly increasing the pipeline to Michigan for personal protective equipment, as well as for testing kits and testing kit components and testing infrastructure. We're working really well with the feds. FEMA has called the TCF Center, which is an alternative care site for COVID-19 patients, a national model in terms of how we've set it up and how we partnered with the private sector and the public sector to make that a reality. The first patients, I believe, are showing up in TCF today.
Right.
And so we have been really working hard to ensure that we can draw down as many resources as possible from the federal government, because we're going to need a lot of help. And frankly, state and local governments are going to need a tremendous amount of help in whatever relief that the feds pass next, because this is putting a significant hole in our state budget. The Stay Home, Stay Safe order has paused the majority of economic activity. So we're seeing a whole lot less sales tax. Traffic on Michigan roads is down 55%. There's a whole lot less gas tax revenue because not only are people driving less, but gas is less expensive than it was when I was in college. So it's going to have an impact on our state budgets, and the federal government is going to need to step up to fill that hole. And I think the mayor of Detroit even referred to there being potentially a $100 million deficit in the city budget because of the human services costs associated with fighting this virus.
Yeah, 100 million is the number that he was saying just today. So you talked about the budget. A question a lot of listeners have, I know it's down the road, if you will, but what about roads? Is that something that's kind of like we need to wait where things are coming? Because that was the big talk before all of this. Is that something that's on the back burner? Do we still need to figure out what's going to happen? What's the story with that?
I mean, all eyes are on COVID-19 as they should be right now, but we are beginning to have these conversations about what the immediate impacts on the state budget are going to be. There is a state revenue estimating conference that happens every May, where we're going to see for the first time the true depth of the economic impact of what we needed to do to protect our communities from the spread of COVID-19. So we don't know yet, but we're going to have to make some tough choices. And that is why we're advocating so fiercely to the federal governments to get the resources we need to fill those gaps.
And then finally, Lieutenant Governor, some late breaking news. You and Governor Whitmer are apparently considering a kind of a liquor refund as a way to provide some relief to bar and restaurant owners. Can you talk a little bit about that and how that might work?
Well, we're considering a number of policies that are designed for us not only to be safe during this time, but also to help keep people afloat and keep businesses able to survive and weather this storm. And so it's something that we are considering, thinking about, given that so many bars and restaurants are not able to sell because they don't have customers, that maybe the Liquor Control Board would be able to look at a buyback program. It's something they've been considering. And so there may be some further news on that soon.
Lieutenant Governor Garlin Gilchrist II. Hey, thanks so much for giving us some time today, and we appreciate it.
Sure, guys. Thank you for having me.
Thank you, sir.
Y'all take care and be safe.
Before we let you go, a reminder that in-depth conversations like these are brought to you by our members at patreon.com/dailydetroit. Thanks to our newest folks, Hunter and Keith, for joining us. Independent, thoughtful media requires independent funding, and thank you for stepping up. You are awesome. With that, I'm Jairus Days. Take care of each other, and we'll get through this together.